One of the biggest problems with today's weight loss drugs isn't the weight they help people lose, it's the muscle they lose along the way. That matters. Because muscle isn't just about appearance, it's your largest metabolic organ. It supports blood sugar regulation, balance, strength, longevity, and healthy aging. So here's the question: what if you could lose fat while preserving or even increasing lean muscle? That is exactly what researchers are investigating with a drug called, let's get to it. Bimagrumab. Unlike GLP-1 medications, this doesn't primarily reduce appetite. Instead, it blocks activin type 2 receptors. Those receptors normally limit muscle growth. By blocking them, researchers hope to stimulate muscle while simultaneously reducing fat. This isn't bodybuilding, it's body recompositioning. So, yeah, nothing to do with steroids, all right? And that is very important distinction. Early research was astonishing. Participants lost over 20% of their fat mass. At the same time, they gained approximately 3.6% of lean body mass. That combination is almost unheard of. Most weight loss medications reduce both fat and muscle. Bimagrumab appears to separate the two. Researchers then combined it with semaglutide. This is where things became especially interesting. In the BELIEVE trial, which involved more than 500 participants, average weight loss reached over 22%. But perhaps the most important finding wasn't the number on the scale. Nearly 93% of that weight loss came from fat. Lean muscle mass was largely preserved. That may ultimately matter far more than simply losing kilograms, because healthy aging isn't about becoming lighter, it's about becoming metabolically healthier. This directly connects to something I've discussed repeatedly on this channel. That is, the quality of weight loss matters. If two people each lose 20 kilograms, but one loses mostly muscle while the other one loses mostly fat, they are completely different outcomes. One becomes frail, the other becomes healthier. The scale cannot tell you that. Only DEXA or MRI can. Does this replace exercise? Absolutely not. Okay, resistance training remains the single best stimulus for preserving muscle. Bar none. Any age, especially for women over 40. Resistance training, right, remains the single best stimulus for preserving muscle. Adequate protein remains essential. We're talking close to 2 grams per kilogram of ideal body weight. Okay, so whatever your ideal body weight is in kilograms times 2, that's your daily protein intake. Good sleep remains essential. No injection replaces those fundamentals. Instead, this may eventually become another tool, practically for people living with obesity who struggle to prevent muscle loss during substantial weight loss. Now let's discuss the limitations. Bimagrumab remains investigational. It's not FDA approved, it's not a peptide, it cannot be compounded. It was originally developed by Novartis and now being advanced by Scholar Rock. Reported side effects include muscle spasms, acne, and higher discomfort rates compared with placebo. Most importantly, we still need larger phase 3 trials before drawing firm conclusions. So is this the end of steroids? No, that isn't even the right comparison. Steroids are designed to maximize muscle growth. Bimagrumab appears to improve body composition in people with obesity. Very different goals, very different biology. Safety levels, don't even let me talk about that, okay? The real story isn't bigger muscles, it's healthier weight loss. And that may be even more important. So what's my conclusion here? If future trials confirm these findings, this could become one of the most important companion therapies along GLP-1 medications. Not because it makes people stronger overnight, but because it helps preserve what matters most during weight loss, your muscles. Thanks for watching. If you enjoy this evidence-based longevity medicine, subscribe, ring the bell notification, invite friends. Thank you. See you next time. We got a lot of stuff coming down the pike.